Hi everyone, Dr. Susan Brown once again from the American College of Nutrition. We're down in Virginia talking with researchers from many parts of the country and the world who are looking at how nutrition impacts bone health. Those of you who are really tuned into the Better Bones program know that blood sugar control is really important, that diabetic people have much worse bone health, they fracture much more, and we want to keep our blood sugar within a very good range. We want to avoid high blood sugar. Well, at these meetings, I'm talking to an interesting researcher from Sweden who actually developed a novel way to control blood sugar, and that involves using this drink, a drink she's developed that you take before the meal a little bit, and then you take with the meal, and it actually is shown to substantially lower blood sugar, the post-meal blood sugar. This is Dr. Elaine Osman from the University of Lund in Sweden. And so Elaine, how does this work? What's your project about here? It's called Good Idea.
Good Idea, and it contains 5 specific amino acids.
5 amino acids, okay.
And chromium.
And chromium, which is very important to blood sugar.
So what happens is that the 5 amino acids help bursting the first insulin release. So
yes.
If you get that going in the beginning of the meal, it's ready for taking the carbohydrates. So once the glucose starts to rise in the blood, this insulin that is already there will help to lower the blood glucose spike.
Yeah, and those of you that really might not be so familiar with the blood sugar issue, that you need the insulin, of course, like to open up the cells to store the blood sugar. So this sort of primes the body with the things that stimulate insulin to get into action just before you eat.
Yes,
is that right?
And then we have the chromium there that improves insulin sensitivity, which means that there will be no overall increase in insulin, only in the very beginning of the meal, and that's when you need it the most.
So it's not that it just raises insulin a little to start out with, and then the body is able to use this all these carbohydrates without raising the sugar too much.
Yes. So overall, we can see a lowering of 25% within a meal.
Yeah, now this is what I thought was pretty outstanding, a 25% lowering of blood sugar with the meal if you take this little drink. And the drink is kind of interesting. It's a little bit carbonated. It tastes like lemon, or there's an orange version. It's one of these many new functional foods we're starting to see in the U.S. And Elaine and her colleagues from Sweden have started is going to bring this drink here. So we'll let you know if we can have some for you all to try. But in the meantime, I think it's very interesting. I think it's very important to control blood sugar for bone health.
Okay, so it is actually available online now.
Perfect.
From our website, goodideadrinks.com.
Good Idea
and
Drinks.
Amazon.
And it is a very interesting idea. We're going to be looking forward to so many new ways that we can adjust our foods to have greater health and greater bone health. Okay, it was fun talking to you all.
Thank you
very much for coming.
Thank you. Bye.
Okay, bye-bye.